Hi, my name is Mary Beth Callahan. I'm a social worker. I work with transplant patients now. Today, we're here to talk about how to have a good future with kidneys and kidney disease. Currently, I work with transplant patients, but over the last 30 years, I've worked with dialysis and transplant patients. And worked with patients who have been on many types of treatment options. Today we're going to talk first about what kidneys are and what they do and what happens if they fail. If we looked inside a person's body, we would see two kidneys most of the time. Each kidney is about the size of our fist, and they're located right above our waist in our back. Many times people think that they're a little bit lower, but they're really above our waist. Now, the big red tree in the middle of that picture is called an aorta, and it's the biggest artery in our body. It brings blood right from our heart to our kidneys. Occasionally, some people are born with just one kidney, or sometimes 3 kidneys, or sometimes even 4 kidneys. Sometimes if there's only one, it is really 2 kidneys that are kind of fused together like a horseshoe shape. But the important thing to remember is that inside each kidney are about 1 million little filtering units called nephrons. N-E-P-H-R-O-N-S, nephrons. And so that's where we get this kind of big word called nephrology, which is the study of kidneys. And that's why a kidney doctor is called a nephrologist. Now, many years ago, when I didn't know anything about kidneys before I became a dialysis social worker, I was amazed to find out all that the kidneys do for us. The main job of the kidneys is to keep water and key chemicals in our body in balance. And this is called homeostasis. It's not that important to remember that word, but to remember that the kidneys keep a lot of things in balance in our body is important. I didn't realize that many years ago. Each drop of blood from our heart is tested by the kidneys with built-in sensors. The sensors detect if there is too much or too little of several things like water, sodium, potassium, phosphorus, or bicarbonate. So to keep us in balance, the kidneys measure levels of water and salt in our blood. They then send the wastes, we'll call them toxins sometimes, and extra water to what we'll call the trash can, which is our bladder. Your body removes them as urine. If there's not enough of one of these substances, they keep it in the blood and send messages to the rest of the body to get more. These messages are called hormones. Kidneys keep the right amount of electrolytes and water in our blood, and they remove waste from the blood that build up from moving your muscles or metabolizing foods and medicines. They check the number of red blood cells in your blood, and that's a very important thing that kidneys do. They send a hormone to your bone marrow to say, make more. And that's going to be a lot about what we talk about in the next few minutes. They also keep water and salts in balance. And this is why kidneys control blood pressure. Now, high blood pressure can harm the kidneys. It takes away some of the filters that we talked about in the kidneys that we saw on that first slide that showed the kidneys. It takes away some of the filters. Failing kidneys can also cause blood pressure to rise. So sometimes we don't know which came first. It's the chicken and egg theory, you know. Removing waste from your blood helps keep your body healthy and working the way it should. So blood vessels and nerves are especially exposed to damage that can occur if waste builds up in your blood. Finally, I didn't realize this earlier on, but finally, kidneys help your bones in two ways, very important to our bones. They convert vitamin D in your skin to active vitamin D, who would have thought? And your gut needs the active vitamin D to absorb calcium from what you eat and drink. Without it, it doesn't matter how much calcium we get. The kidneys control levels of calcium and phosphorus in your blood, and our bones are made of these two minerals. An interesting question is what happens to the body as the kidney fails? How might this affect how you feel? Well, let's start with anemia. Remember, that's not enough red blood cells to carry oxygen throughout your body. Some of you may have anemia, and some of you may already know what anemia feels like, but many people with anemia feel tiredness and maybe some confusion. But anemia can be treated, and you can have more energy. Your nerves, blood cells, and heart can be affected by less kidney function. Nerve damage is more common with less kidney function as well. You may feel nerve damage as burning or tingling in your hands and feet. It can also cause memory issues and sleep issues, muscle weakness, and other problems. If the calcium builds up in blood vessels, they can become stiff, which affects blood pressure. You may have heard of hardening of the arteries. If minerals are out of balance, bones can be weak. Although all of these things sound worrisome, these problems can be treated. But it can help you to know why balance is so important. The other thing I think that's important is that as we talk about these things, I think it reminds me that it's important to take care of ourselves as early as possible because these things can be treated and we want to treat them as early as possible. Now, let's talk a little bit about why kidneys fail. There are basically two types of kidney failure. There's acute kidney failure, which means that it's sudden and maybe the kidney failure is caused by a shock to the kidneys. This might be that there wasn't enough blood flow to the kidney or there was a toxin, a poison, something that happened to the kidneys. This may have been like NSAID pain pills, contrast dye from X-ray dye test, or certain antibiotics. Sometimes, but rarely, proton pump inhibitors, which are some types of anti-acid medications. Rarely, cholesterol clots, sometimes called an emboli, can occur during heart surgery and block the blood vessels in the kidneys. All of these would be considered acute kidney failure. If someone survives acute kidney failure, their kidneys may recover, even though this might take a year or even longer. In some cases, there's enough damage that people who survive acute kidney failure develop chronic kidney failure down the road. So a person that's had acute kidney failure would want to be especially watchful of their kidneys following such an event. Chronic kidney failure is a longer, slower process. And sometimes it's happening and people aren't even aware that it's happening, especially if it's happening with high blood pressure. Sometimes people will come into my office and they haven't known that they had high blood pressure, and in the process of having high blood pressure, some of those filters in the kidney have been going away, and thus chronic kidney failure has started. And so sometimes because the damage to the kidney happens so slowly, you may not feel it until it is more advanced. And then it can be hard to believe at that point that there is a kidney problem. At the same time, it's still important to remember that a person can have a good life with kidney disease. Now, some of you may have had an estimated glomerular filtration rate, which we call an eGFR. This is a standard measure nowadays of the stages of chronic kidney disease, and it's a measure of your kidney function. Healthy people have a GFR that is 90 or higher. CKD has 5 stages based on the estimated GFR. Stages 1 and 2 usually means that maybe a problem at birth happened, and that's why a person has a lower kidney function. Most people don't find out that they have CKD until stage 3 or 4, or maybe even stage 5. If in stage 5 the GFR drops to about 7, that usually means that the person has kidney failure, or what's called by the government end-stage renal disease. And at this point in time, kidney transplant or dialysis is required to remain alive. Once the kidneys fail due to chronic kidney disease, there's no way to make them work again. At that point, again, the person needs dialysis or transplant to remain alive. So we're going to look at some of the symptoms that might come with a failing kidney. We talked about fatigue, and when a person looks at these symptoms, they may seem unrelated, and you can see how it'd be kind of hard to put them together in a puzzle and say, this means that I have kidney failure? But indeed, there is this group of symptoms that the more a person has of these symptoms, the more we know that the kidneys are failing, and the person is probably going to do better with treatment, whether that be dialysis or transplant. And this is a good list to be able to keep track of and to be able to tell the doctor or the healthcare team that you're seeing, because even though lab tests are important in terms of keeping track of the progression of your kidney disease, the way the kidney disease impacts your day-to-day life is very important. And if you keep a list like this that you can check off on a monthly basis, and it may become even a weekly basis as time passes, or a daily basis, this is going to be very helpful for your physician to work with you to know when it might be time to begin dialysis. So, once again, what do kidneys have to do with red blood cells? And this was very interesting to me when I first found out about it years ago. They tell the bone marrow to make the red blood cells. I would have never known this. The kidneys talk to the bone marrow by sending a chemical messenger, which is a hormone called erythropoietin, or EPO for short. And as the kidney function drops, you make less EPO. This can mean that you have fewer red blood cells, and fewer red blood cells equals anemia. Most of the symptoms of chronic kidney disease are caused by anemia. So you may be wondering, if I'm going to be feeling this tired, am I going to be able to keep working? Well, I'd like to ask you to try to think of continuing to work, because even though anemia can make people feel tired and make you feel like you want to quit your jobs. There is treatment that can address this. It's important to tell your doctor that you're feeling tired and that you need the treatment. But unfortunately, Social Security disability is not meant to be a quick resolution to a person becoming ill. It takes 6 months of no earned income before a person qualifies for Social Security disability. And then after a person qualifies for Social Security disability, you may earn or receive only 1/3 or less of what your current income is. So that can be very difficult in terms of lifestyle changes. And so if it's at all possible to remain at your job and get treatment for the anemia, that is going to be a very good choice for you if it's at all possible. The test for anemia is a blood count that we look at for hemoglobin. It measures the level of red blood cells. And once the medication is given to treat the anemia, it takes about 6 weeks for the new red blood cells to grow back. So again, talking with your doctor about your symptoms as well as the blood cell counts is going to be very important. But I do want to encourage you to remain with your employment if it's at all possible. Anemia treatment comes with 2 medicines. There's iron, which is a building block to help make the red blood cells. So there's going to be a couple of measures that the doctors look at when they're looking at keeping your anemia in good measure. You may be given pills, but in general, these are not easily absorbed. So your doctor may prescribe iron by injection or IV. When given this way, iron is better absorbed so your body can use it. Sometimes there's a risk of allergic reactions, and that will certainly be taken into account. Then the other drug is erythropoiesis stimulating agents called ESAs, like EPO. If your kidneys have not failed, your doctor will likely prescribe Aranesp or Procrit injections for you. If your kidneys have failed, your doctor may prescribe Aranesp or Epogen. And for your safety, your doctor will be measuring a target hemoglobin. And in chronic kidney disease, that is lower than it is with healthy people. Itching. Itching, itching, itching. It can be very aggravating, and it is a symptom of chronic kidney disease, and it can be so aggravating it can even make a statue itch or scratch. I always have trouble with those 2 words. Often, the itching is caused by a buildup of phosphorus in your blood. As kidney function drops, the kidneys remove less phosphorus. Phosphorus is one of the most common minerals in our food supply. Nearly every food has it, especially meats, dairy, nuts, whole grains, chocolate, and cola drinks. But you need good nutrition. Someone can help you figure out this puzzle and help you to figure out which foods to limit and which ones that you're able to continue eating. But also, your doctor may prescribe phosphate binders. There's a whole assortment. These are taken with food, with all food, and only with food. They bind with the phosphorus before it gets into your bloodstream, and it's removed in your stool. Some binders are over the counter, but some are prescribed by your doctor. So be sure to check with your doctor on this. Once kidneys fail due to chronic kidney disease, they can't recover. Again, we spoke about acute kidney failure, which sometimes kidneys do recover. But here we're talking about chronic kidney disease, and they can't recover from that. There isn't a magic pill that will fix failed kidneys, or I remember for a while there were drinks that were being sold, but unfortunately this doesn't work. But there are treatments that can sustain your life if your kidneys fail. There is also comfort care, using medical management without dialysis and allowing natural death to occur. It's important to remember that you have choices. If your kidneys fail and you choose to live, there are two main treatments. You can replace your two failed kidneys with one healthy kidney from a donor. This is called a kidney transplant. Now, usually your native kidneys, as we call them, the kidneys that we're born with, are not removed unless sometimes for people who have polycystic kidney disease, if the kidneys are too big, one of them or maybe both might have to be removed. But normally the kidneys that we're born with are not removed. A transplanted kidney is put in a different place. If you have type 1 diabetes, it's possible to get a kidney and pancreas transplant. If this works, you would not need insulin or dialysis. Some people who use insulin for type 2 diabetes may also be able to get a kidney pancreas transplant, depending on the transplant center. The other thing is that you can also have your blood cleaned and filtered. This is dialysis, and there are several ways to do dialysis. The other thing is you don't have to treat kidney failure. One option is to let natural death occur. This is called medical management without dialysis. It's care to keep you comfortable and to treat your symptoms, but to not extend your life. Hospice services can help you and your family, whether that's in a hospice setting or in your own home. You can choose comfort care at any time, even if you've already started dialysis and you choose to stop dialysis. Most people who only have kidney failure choose to begin dialysis or have a transplant. Sometimes when people have other disease processes and kidney failure, so other disease processes like cancer or dementia or a lot of pain and no real hope for recovery, may choose medical management without dialysis, which is also known as palliative care. So your treatment team, your doctor, your social worker is there to help you in whatever your decision is. Now we're going to talk about Nancy for a little bit. Nancy had a plan for a good life after kidney failure that included many types of treatments. She was 19 years old when she went through a life or death committee back in Seattle to get on dialysis in 1966. Back then she did home hemodialysis at night while she slept. While she was on dialysis, she went to college and got a teaching degree. Later, she went back and got a nursing degree too. She has done, I think, every kind of dialysis, and now she has her fourth transplant. While she had her first transplant, she got married and had 2 children. Her son Josh is in the photo with her. I believe today Nancy is still working part-time as a nurse, and I know she travels the country at invitations to share her experience with others. And she's also a breast cancer survivor. She also has a beautiful grandson. So I'm always encouraged when I read something by Nancy or see pictures of Nancy. She has done a lot of work helping other patients and social workers be aware of what a person can do with kidney failure. She was a part of a large movement in the early 90s to help healthcare professionals such as myself understand that rehabilitation in terms of employment and an increase in functioning was certainly possible, that we could change what was happening in dialysis for patients. So I thank you, Nancy. It's important to get used to the idea that some type of surgery will be necessary to live successfully with kidney failure. Transplant, of course, requires surgery to put in a new kidney. And any type of dialysis that a person would choose would require an access to be placed so that the blood can be cleaned, whether that would be peritoneal dialysis or hemodialysis, which we'll talk a little bit more about. So just the idea of requiring some type of surgery will be something to get used to. As we talked about, the kidneys, our native kidneys, are above our waist, under our ribs. When we get a transplant, the new kidney is placed in your belly, kind of around the pelvic line. In most cases, as we talked about our own kidney stay, when you need two organs, sometimes like a pancreas kidney, you're able to move a little quicker on the transplant list. Today, living donation is something that allows a person to be transplanted more quickly as well. Peritoneal dialysis is a way to clean your blood without taking the blood out of your body. PD, as we say, is easy to learn and do. A nurse will train you as the patient to do this and train you until you know how to do it. There will be a 24-hour line that you can call. So even though this may look like, oh my goodness, I'd never be able to do this, someone will train you until you know how to do it and feel comfortable doing it, and then you'll have a 24-hour line that you can call if there's any problems. But we'll talk more about how this might fit into a lifestyle later in another session. But PD uses millions of blood vessels that line the inside of our abdomen that's called the peritoneum as a filter. A surgeon puts in a PD catheter, which is a plastic tube like a soft straw, in our belly area for the PD access. And as I said, during training, they'll teach you how to keep the PD catheter very clean to avoid infection. And even people who have vision problems can learn to do PD. I've had several patients over the years who had vision problems who've been able to do PD as well. So again, don't assume that you have limitations that can't be overcome. Ask. For hemodialysis, your blood comes out of your body through tubing, and only about a half a cup of blood is out of a person's body at any one time, but it goes through a filter to be cleaned. And there are 3 ways to get access to the blood for hemodialysis. We're going to talk about those. First, there's a fistula, graft, and a catheter. Of these, a fistula is considered the best type of access. Some ways to make an access for dialysis are better than others. Dialysis needs the strong blood flow to an artery. Veins are closer to the surface of your skin and easier to reach. So connecting an artery and a vein gives you the best of both worlds. Surgery can connect your own artery and vein under the skin of your arm. There are 2 ways to do this. The best hemodialysis access is an arteriovenous fistula, or AVF, Mostly, we just know it as a fistula. A surgeon connects your artery to your vein. A fistula is all natural. There are no man-made vessels or tubes. Fistulas have the lowest risk of infection and blood clots. Usually, often, a fistula can last for decades. This is most likely if one person, preferably the person with the fistula, puts the needles in it. So that's something to consider as you think about what type of access you're going to have. To make a graft, a surgeon connects your own artery and vein with a piece of man-made vein. Since the graft is foreign to your body, it is more likely to have blood clots than a fistula, and it still has some risk of infection. Grafts wear out and must be replaced. A graft may last for a few years. The access surgeon can do testing before your surgery to find out which might be better for you. But it's okay to ask the surgeon if he's familiar with doing fistula surgery as well. And ask also if he suggests a graft why a fistula is not something to be considered. It's okay to ask those questions. So remember, we talked about a PD catheter, and that's a good type of access. Now, what we're looking at here is called a hemodialysis catheter, and it's one that we would like to avoid if it's at all possible. Hemocatheters are used if someone needs dialysis now, right now, and has no other choice. It's partly out of your body and partly in your blood vessels. The tip of it is in your heart. Why we don't like to use it is because germs can climb up the tubing and get into your bloodstream. The risk of infection is much higher. Blood poisoning or sepsis can occur, and sepsis can land you in the hospital, and it can also be fatal. And so we really try to avoid this if at all possible. Hemocatheters have a risk of death many times higher than that of other hemodialysis accesses. You may not be able to shower with the hemocatheter. It can't get wet. Also, catheters cause scars, and most people need mini catheters if they use them. So even though people sometimes may think, oh, this is going to be easier, it's really not. I really want to point out the high risk of infection and the concerns that go along with having this type of catheter. We want to encourage you to get an access, a fistula if possible, a graft if not possible, or a PD catheter placed to avoid having this type of hemodialysis catheter placed. If there's any chance that your kidneys could fail, protect your veins. A dialysis access is your lifeline. You only have about 10 places on your body where an access can be made, so each one counts because we want you to have a long and good life with kidney disease. Medical procedures can harm your veins, so they can't be used for an access. Don't allow blood tests on the arm you don't write with. If you must have blood drawn on that arm, see if they can use your hand. Tell the phlebotomist that you have kidney problems and are saving your veins for dialysis. And if they look at you funny, please ask them again nicely, because they may not understand as much as you understand. Remember that you may know more by the research that you've done, and it's okay to ask them nicely to just please take it from this arm. Some groups offer a wallet card or bracelet you can show medical staff. Even taking your blood pressure can squeeze and damage veins. Have your blood pressure taken on the arm you write with or even your leg. Avoid IVs and PICC lines in the arm you don't write with. If you're in the hospital, have a nurse put a sign behind your bed to tell the staff. Some of the takeaways from our talk today. You've learned that the job of healthy kidneys is to keep balance in your body. Homeostasis, balance. The symptoms you may have are due to the lack of balance that comes when your kidneys are failing. Most symptoms can be treated so you feel better. There are many treatments that can help you live if your kidneys fail, or there is comfort care if that is what you prefer. All of the treatments for kidney disease that help you live need some type of surgery. An important thing we've talked about is that a vascular access is your lifeline if you choose hemodialysis. So protect your vessels now in case you ever need them later for an access. Here are some websites so that you can continue your learning from today. Kidney School is an excellent website to help you with modules that will give you information on a number of topics that you might be interested in, and there are a number of other websites. It's been my pleasure to talk with you today about a good future. Thank you for joining us.